Good evening, everybody. Welcome to this webinar regarding the COVID-19 situation within Kirklees. What we thought would be a good idea is to invite all the voluntary community sector leaders and the faith leaders, not least because we've not talked for a bit, but there's actually a lot of water that's gone under the bridge, and we're just going into the festive period, Christmas, and we also have got some good news in terms of we're going to be rolling out mass testing in the borough, and Rachel will hopefully talk a bit about that later on. And also want to just touch on the vaccinations. So with me today, I've got Rachel Spencer Henschel, who's one of our who is our strategic director, and part of her role is to manage and oversee the public health function. I've also got Councillor Carol Patterson, who's my cabinet member, who's the portfolio lead for learning, aspiration and communities. So the communities part of the world she leads on. There's also Jane O'Donnell, who's going to be helping Rachel in answering any of the questions that might come up. And there's Joe Richmond on your screen. Joe's actually quite new. You may remember Carol Gilchrist, who was our head of communities. Well, Joe's just taken over that role. So I just thought it would be good for Joe to actually come on, and she might say a few words at the end. I'll leave that to you. I don't want to put in the deep end because she's actually just joined us whilst we've been in this pandemic. Once again, a heartfelt thank you for everybody who has supported not just your communities, but you've been the vanguard of making sure that communities actually pull through this together. And you've done a lot of the work that I could have only imagined in terms of the difficulty we've got, where the private sector has literally come to a halt, and the public sector has come into its own. But it's people like yourselves who have actually done some remarkable work, who have actually supported the whole infrastructure around people, and this is what it's about. One thing that this has brought out to me is people matter. So we could be in our organisations, in our silos, but what makes our communities tick is the heartbeat that you generate that keeps us all moving forward, and that's really, really appreciated. Just to give you an example, over 140 mutual aid groups have been established by local communities like yourself, and many of you will be on this call. We've had over 1,500 volunteers who have come forward to support the council, the NHS, local services, and most of all, you've come out to actually help individuals, your neighbours, and that Dunkirk spirit has actually really come alive in Kirklees. I'm really, really proud of that, and once again, that is due to the hard work that you have done. We've had nearly 4,000 requests for support through the council support line, and again, you've played an active role in that. And COVID-19, like I said before, has highlighted some major issues and major risks within our vulnerable groups, and it's amplified the massive inequality, poverty, deprivation, and the social mobility issues in our communities. I hope that the government actually is taking this very, very seriously, because we've been banging on about this for many, many years. The government has actually committed to the levelling up agenda, which is really, really warmly welcomed. But this pandemic, the way I'm seeing reports come out, and there was a documentary yesterday on the news, which showed that the inequality and the gap between the rich and the poor is actually widening. And this is not society that we want to be part of. In terms of the current public health picture, it's been like a roller coaster. 1 minute we're really good, next minute we're really down, and the figures are going all over the place. And what I said to the people I meet in my offices is, look, we can only do our best to manage and predict human nature, human behaviour is like gazing through a crystal ball. And the pandemic has actually caught everybody out by surprise. But I'm really, really pleased that our rate in Kirklees is actually coming down rapidly. We are now below the national average, and in the past we've been above the national average. But again, we just need to be mindful. The reason why we are below the national average is because everybody's gone really, really high. And you've seen, particularly in the northeast, a lot of local authorities are now peaking above what we were when we were peaking. So we've still got a long way to go. And what we don't want to do is we don't want to get into a situation where we come back soon after Christmas, and we're talking about a situation where our figures are even higher than anybody else. We are 70 out of 149 upper tier local authorities in England, and Kirklees is he was the highest in West Yorkshire, but now we're sort of like below Wakefield and Leeds. Bradford and Calderdale are higher than us, so we're sort of like sharing. Some people would argue that we need to go out of tier 2. Some people would say that actually we need more restrictions. The government made their decision last night and this morning, and in West Yorkshire, all the tiers are going to stay. All the authorities are going to stay in tier 3. But I see that as a blessing in disguise, if that's the way I can put it, because we all know that next week, over Christmas period, there's going to be a 5-day easing of lockdowns, and to be honest with you, I'm really worried about that. But at the same time, I'm also quietly confident that the messages that we've been passing out through the council and through organisations like yourselves, we will take a responsible approach in terms of making sure that we keep that mixing of 3 households to a minimum. We ensure that we don't sort of like go and do something silly. We use the 5 days wisely, and again we talking about human behaviour. And I can see the wisdom in government, because let's assume that they actually locked everybody down and kept things back as tier 3 would dictate. Then human behaviour is very difficult to control, and so it's a decision that's made by government. I might have a different view, or I might do things differently, but I think what we need to do is we need to focus on Kirklees, and we need to make sure that we keep our figures coming out of Christmas into the new year as low as possible, and that's where we all need to work together to make sure that happens. And it was only announced this morning that we are going to be staying in tier 3. We need to take care. Infection rates are kept low, and we don't want to be in a situation where they rise significantly. Testing is very important. Today we've launched our new mass testing site, and there's one in Batley, there's one in Dewsbury, and there's a couple in Huddersfield. Again, Rachel will hopefully go over the details on that. What I would urge everybody to do is while you have the opportunity, get tested, because the more people we can test, the easier it will be for us to actually take some control of the virus. And as you know, vaccinations have started to be rolled out over recent weeks, and in Kirklees we have started to vaccinate people. It's a pecking order in terms of the most vulnerable, over 80 year old first. And I'm hoping that in the next few weeks, certainly, that we actually get another vaccine which is more stable, and that we can start rolling out the mass testing, vaccination program. And let me just give you a context of the challenges we're facing. In a normal winter, we nationally vaccinate around 9 million people, and that's done over a 3-4 month period over winter. This time round, we need to vaccinate around 90 million people twice. That's why you've got the figure of 90 million. So you can just imagine the mammoth of the task in front of us is huge. So we will do everything we can to work with the NHS and the primary care networks, because they are the organisations that will be leading on this. But what we've told them, that we have the expertise, both as a council and as a community infrastructure organisation, where you people will play a massive part from the community one sector. And if they use your skills and your abilities and your knowledge and your experience along with ours, we'll make sure that things are done in a speedy way. So what I intend to do now is I'll pass over to Carol Patterson, who will say a few words, and then what I will do is I will ask Rachel, who will then provide an overview of what the situation is, and we've got some question answers that we can take. Joe will help me do that, and then we'll see how it goes. The plan is to finish by 5 p.m. So once again, I thank you for taking the time out to come and listen and ask us questions. So Carol, can I ask you to say a few words? Thank you.
Yes, thank you, Councillor Pandor. I won't say much. I mean, I can't say an awful lot more than what you've already said, but I will say welcome to everybody to this webinar. And I just want to really reiterate what Councillor Pandor has already said, and how we all need to help to keep our communities safe. And we've all got a responsibility to do that, but by keeping ourselves healthy and safe, and by encouraging others to do so as well. I mean, the government, as Councillor Pandora said, the government have today said that we will remain in tier 3, albeit that our rates have come down, and that is for good reason, because we're not out of the woods. It is coming down, but it's slowing off. That rate decrease is slowing off, and perhaps people are becoming a bit blasé about it now. But we can't take our eye off the ball. We do have to keep remembering that the virus is there, and it's I know from personal experience, not myself personally, but when it gets into a member of your family or your congregation, it spreads very quickly, and then it's not a good thing to see either the elderly or the young when they get it. It's not a nice virus. So I've just got a plea really to you all, and to all the people that you're able to influence in any shape or form, is when you do get the call to have a vaccination, do take it up, or encourage others to take it up when they get it. The NHS will be in touch with you at some point. As Councillor Pandor said, there's a pecking order to that, so the most vulnerable go. But when that call to vaccinate comes, then do it. And similarly with mass testing, do take advantage of that as quickly and as often as you can or need to. The more that we get people vaccinated, the more that we do mass testing, then the more that quicker we can say goodbye to this ugly virus. So that's all I really want to say. So thank you for everything that you've already been doing, and for what you will continue to do. I know you will, to help, as I say, keep all our communities safe. So thank you.
Thank you, Carol. Can I pass over to Rachel now? And if you want to bring Jane in, Rachel, feel free to do that. Over to you, Rachel.
Thank you so much, and thank you to both of you for the introduction. I just want to reiterate some of the points that Councillor Pandor said in terms of we wouldn't have got this far without you all and the efforts that you've put in to support the council and work in partnership with us and our other partner colleagues to try and bring the infection rate down. I think it's really important to say that although it's really positive news that our rates have come down, they are still at quite a significantly high level when you look at the numbers that we were seeing across July and August. So it feels like we are not out of the woods yet, even though we have made such progress in terms of those numbers coming down. Our rates across Kirklees at the moment are 162 cases per 100,000 population. Now, we hit a peak of around 570, which was in the beginning of November. So that is a big drop. So again, thank you to everybody that's been involved in keeping those rates down. I think, though, it's probably worth articulating a little bit more what Councillor Pandor said about how inequalities are having such an impact for us in Kirklees. So the rates across, for example, the Dewsbury West ward are around 300,000 per 100,000 population. So that's roughly double what we're seeing as Kirklees as a whole. So clearly there are inequalities at play in terms of how the virus is affecting our communities. So it's really important that we continue to play our part in terms of keeping those rates down. Now, as the leader said, the council is doing a number of things to try and help, because I guess from my perspective, I think it's important to say that I think we've got another 6 months of trying to manage the virus and the rates in our communities whilst the vaccination programme is rolled out. So as the leader said, the programme is being managed by the NHS, and it will be done in a risk-based way. So you will be called for vaccination based on your age. What we need to be doing is making sure that during that time, while we allow the vaccination programme to roll out and for people to become less vulnerable and safer, that we are keeping those rates of the virus as low as we possibly can. And we will all need to work together to do that. So there's a number of things I want to update on that the leaders already articulated in terms of some of the plans that the administration have pushed for and put in place. And those are that we've got our own local contact tracing service. So that essentially means that if the national NHS test and trace scheme don't manage to contact you, we've now got a local scheme with a local number where people that are trained and experienced in contact tracing will try and get hold of people and spend time talking through what they need to do as a case with a positive result. And that's really important because the pilots that we've seen in other areas show that it has a much greater impact, because we know our communities a little bit better than the national NHS test and trace. So we've got a better chance of supporting people. We can also work with them on what additional support they might need to self-isolate, whether that's about accessing funding or whether that's about joining into our community response scheme, which I know a number of you as VCS organisations and faith groups have been part of and are instrumental in achieving. So that's very much something that we've done locally to try and enhance what our offer is. As both Councillor Patterson and the leader said, we're really keen to push mass community testing. So at the moment, if you have symptoms of COVID, you go get a test by booking on the national site, and they will send that test off to a lab and you will get a result. What we've now got is a set of tests that are called lateral flow devices. That might be something that you see in the literature. But essentially what that is it's a test that will give you a result in between 20 to 30 minutes. So obviously what that allows us to do is to be really quick in terms of telling people whether they have got it. Now, this test is particularly effective for people that have no symptoms but are actually carrying quite a lot of the virus. And we know from outbreaks that we've had in the past. So we had an outbreak at a food factory, which you'll recall back in May. What we found with that is there was quite a significant proportion of people who were carrying the virus but had no symptoms whatsoever. So these lateral flow devices allow us to identify the people that are carrying it and not know, which is obviously really important in terms of those people self-isolating for the period of time in which they're shedding that virus. So it helps to protect the people that they would come across and unknowingly pass the virus to. So as the leader said, we've got 4 sites that will start tomorrow and they will open tomorrow. We've got comms going out so that we can reinforce that people can just turn up, and we want that to be open to anyone that lives or works in Kirklees. And they are ideally about people getting tested every week so that they can have an additional bit of reassurance in terms of finding out whether they've got the virus or not. Obviously, that's still going to mean that people need to follow the guidance in terms of wearing a face covering, washing hands and keeping social distancing, because the test is only going to be an additional support on top of those measures. But it feels like by getting that testing in place, we're going to be able to really help to keep the rates down in Kirklees. And we are targeting that within North Kirklees specifically to start with an aim to rolling it out across the whole borough. But as the leader said, it's so important that we focus on our communities where we know the rates are highest and do everything that we can to support them to keep those rates down. So we'd be really keen to hear from you about how you could help us with getting the messages out about testing, as well as getting the messages out about the importance of the vaccination if you are called in by your GP surgery to get that vaccination. So I think that's probably it, Councillor Pandora, unless there's anything I've missed from my update.
No, that's great. Jane, do you want to add anything, or are you going to take questions and answers? You can contribute if you want.
I'm quite happy to take any questions. I think Rachel's covered what we wanted to say this evening.
Right. Okay. Well, I've got one or two questions that have come to me directly. One is in terms of the vaccinations. What role can the voluntary and community organisations play in helping to help the council and the NHS, and B, getting that message out there to make sure that until we all get vaccinated, we will still be in lockdown or restrictions. Because one of the things that the question said was that everybody needs to get vaccinated because a lot of work has gone on. So I don't know if Rachel wants to answer that, or Jane.
Yeah, I can answer it. I think, I mean, it's music to our ears, because obviously the more support we can get in getting the messages out, the better. So I suppose the ask from my perspective would be, at the moment, as the leader said, we're kind of, it's up to the NHS to determine how the vaccine is rolled out in terms of the different age groups and how that's going to get managed. So I was always expecting that to be the case. But what's really important is, if there are messages that are being spread in the community that perhaps are unhelpful or need challenging, or if from your perspectives, knowing that the communities that you work with, if you think there is a way that we can tailor our messages that will reach more people, we'd rather co-produce that with you. And if you can be advocates for getting those messages out for us, that would be even more important. And I know that a number of you have been involved in some of the videos that we've done in terms of getting messages out about the virus. We know that's been really successful, so we want to replicate that around the vaccine. So I think it'd be really, really important that if you come forward to us and talk to us, that we work with you on how we can tailor those messages, because often there are different trusted sources in different communities, and we want to tap into all of those so that we get that out and we get those key messages, because as the leader said, it's so important that as many people as possible get this vaccine.
Right, thanks very much. Jane, do you want to add anything?
No, I think Rachel's covered everything in that. Thank you.
Yeah. Okay. I've got another question that I've got here that's just come through. Is it safe in the testing centres, especially if you're vulnerable?
We need to sorry, I'm happy to take that, Rachel. Yeah. We need to reassure people that people will be socially distanced within the testing centres. There will be a requirement that people wear a face covering to protect others and along with themselves. Staff will have been trained. They will be wearing appropriate PPE. And regular cleaning. So I can assure you that within the testing station, people will be extremely safe.
Right, thanks very much. Anybody want to add anything? Carol, you feel free to chip in if you feel appropriate.
Well, at this point, I will just chip in and say, yeah, I really do hope that there are not people in the community that are frightened to take advantage, basically, of the testing and the vaccinations that we're offering. I know we've all seen members of our communities who haven't followed the guidelines, who don't feel that they don't affect, they don't mind if they get COVID, but it's not whether they get COVID, is it? It's whether their family, their friends, their work colleagues, it's whether or not they're passing it to other people. That's the problem. And that's the same with the vaccinations and the testing. By getting vaccinated, by getting tested, you are protecting others. It's not necessarily just about yourself. It is about protecting others. And I think that's the message that we would like you all to help to get over, really. I think that it is safe to participate in the vaccinations and the testing, and by doing that, you are helping to protect your communities and other people. That's all I'll add just at the moment. Thank you, Shabir.
Yeah, Another question has come in terms of the vaccine. In terms of the way the vaccine is going to get rolled out, will there be more venues available to actually get the vaccine take up occurring at a faster rate? So at the moment, I think it's just in one or two centres and in hospitals. So will they start to roll them out in further community settings, in GP surgeries, and will that be beefed up in the future?
Yeah, I'm quite happy to take that. There's different waves with how the vaccine's is being rolled out, and obviously as other new vaccines are hopefully licensed, that will give greater opportunity for the vaccine to be given in GP practices. So because of obviously of how the vaccines being rolled out by age groups, by vulnerabilities, and about the amount of vaccine doses what are given at the moment with the Pfizer vaccine. But as the waves increase, there will be more opportunities and more sites for people to access the vaccine. The GP practices will get in touch with the patients to let them know. So it's a case of wait for your GP to contact yourself.
I've just got a couple of comments I think it's worth reading. First one is from Reverend Martin Naylor. Says that he will be encouraging testing, so thank you, Martin. We need to get as many people in Batley vaccinated, and Martin's a vicar, a priest in my neck of the woods in Batley, and we need to get the message across so that every single help that you can give it, Martin. And I know that you do work on an interface, cross-faith basis in Batley. We just need to get more of that going. And I've got another comment from Reverend Janet Hanging from Eton Methodist Church, saying that thank you all for all the support. I'd like to say thank you, Janet, to you, because without you and the support you give us, we would not be where we are. So it's a partnership, and it's working together. So we all need to support each other. Another question that's come up regarding tiers. How will we be able to move into a lower tier? And if the figures went back up, would we go back into another higher tier? So basically, it's easy to move down to a tier, but would that mean that if figures went up, they'd go into a higher tier again? So how would all that work? Rachel, can I bring you?
Yeah, absolutely. I mean, I think one of the real challenges around the tiers is that they have put together a sort of suite of indicators which the government will look at alongside Public Health England to determine whether an area moves between tiers. I think the expectation at the moment is that is looked at every fortnight. Now, they haven't necessarily been clear about what level you have to reach in order to move. So I suspect that you could, for example, have a lower rate per 100,000 population than another area that's in a lower tier, but it might be that your NHS capacity is at a higher level. The capacity is fuller than it would be in that area, and the judgment might be that we need to stay in the tier that we're in. I think it's a really tough call, is the tiers, because I think that there is a very mixed view about what people think would work better, particularly for things like hospitality industry. So is it better to go in and out in a short period of time? Because that would very much happen in terms of that question. So if they deem us able to move into a lower tier, as soon as rates started to go up, I think they would review that and change that. Which is why I think it's so important to try and keep the rate as low as we possibly can, to give us that better chance and for it to be in a more sustainable position, so that if we do move tiers, we move tiers for a longer period of time rather than a short period of time. And I think, as the leader said in his introduction, and I share his concern, the relaxation of restrictions over the Christmas period will inevitably lead to increased cases, because one of the things I think that's so important about this virus is that winter in itself is not, it is the enemy in the sense of how we protect ourselves, because being inside with all the windows and doors closed and no ventilation is a real breeding ground for this virus. So certainly from my perspective, I'm encouraging people to, you know, if they are trying to see family and friends, to do it outside. If they can, go for a nice winter walk, or if they are going to be inside, to try and really be strict on the social distancing, regular hand washing, and keeping windows and doors open, even if you have to wear an extra jumper, just so that it helps with keeping the virus and the risk of transmission down. So I think that you know, the 5 days over that period is going to potentially cause an increase in cases. So it's probably certainly from a public health perspective, better that we've remained in tier 3 until we understand the real impact of the reopening of non-essential retail, and then what happens over the Christmas period. But obviously the leader, myself, will be kept informed in terms of what national discussions are going on around that.
Thank you. I've got Reverend Mark Umpleby, another priest in my neck of the woods in Batley. We're doing well today. A couple of comments and a couple of questions as well, I think. Firstly, he's really pleased that mass testing and vaccinations and the publicity around that is really encouraging, and he wants to support everything we do. Thank you, that's really appreciated. And next one is probably a question. It probably would be helpful to have faith leaders having the test done and to put on social media, so it gives that confidence. So it's something we can work on. And again, he mentioned, you know, doing that in places of worship. Again, it's very powerful to actually get that positive message out there. So I think we can take that back, can't we, Rachel? Can we say anything more now? I think it's a good idea.
Yeah, I'd certainly build on that. I mean, that is a really excellent suggestion, and we're always keen for anybody to come and get a test, so that we can use that to try and encourage others to get tested. What Jane and I are working on as well to support the mass community testing is how we can use those rapid tests to target. And so at the moment, we're trying to look at some of those businesses that we know have been particularly hard hit by COVID because of the kind of working environment and the working conditions. So we want to try and look at how we can use those tests in a targeted way there. You'll have seen the announcement this week around using those rapid tests in schools. There's still quite a lot of unknowns about how that's going to work and how that's going to get rolled out, but certainly we need to understand the impact of that on schools. And I think that we'd be keen to look at, we're looking at those sites and those settings where we have had outbreaks. We've got vulnerable people. So, for example, we're looking at how we can get staff in children's homes, residential care homes, special schools, all of those to have regular tests, which just adds an extra layer of protection for the vulnerable residents. But certainly, it would be fab to get some, you know, key community leaders, contacts to come and get a test, and if we can use that in our publicity, that would be excellent. So yeah, we'll take that away, Councillor Pandora, and obviously anybody can put their name forward and be part of that. That would be great.
Yeah, a few more questions. How do we find out where the test centres are? How are the numbers at test centres managed in terms of, you know, flow of people coming in, and how do you book a test? Do you want me to repeat that again? Are you okay?
I'm all right with that, I think, but tell me if I've missed a bit.
Yeah.
First of all, there is no booking required, so I think that's important. You can just turn up, and we'll have staff on the ground who can have a conversation with you, share information that we've got in terms of helping you understand about the test, and you know, really get an understanding of that. We're not really sure what the demand is going to be like. I think there'll be it will build build. I think we'll start probably small and then build. What we want to be able to do is provide kind of queue management, so that if somebody turns up and it looks like they've got to wait for a period of time, we can tell them that they can go away and come back again, so that we can actually manage that, so they're just not hanging around. But it's very much going to be a bit of suck it and see, because we're not sure what the demand is going to be like. But certainly there's no booking required like there is with if you've got symptoms. It's important to mention that if you do have symptoms, these rapid tests are not the ones you just need to book a test as normal on the site and go to the mobile testing unit. So it's really important that if you're symptomatic, you still follow what we've always said right from the start, which is to be able to isolate, book a test, go get one, and obviously you'll get the result in due course. What this is really good for is people who aren't experiencing any symptoms and want to find out. The details of the venues will be announced later on today, so we'll make sure you get those. Joe, we can send that out, can't we, in terms of the details? Did I miss anything, Leader?
No, you didn't. No, you didn't.
Oh, okay.
I'm trying to find my phone.
Oh.
All the questions that come from my phone, and I just put it somewhere and I can't find it. But anyway, not to worry. I think I can see it on the chat anyway. Another question that's coming earlier on is, and again, this is probably something that we can't really manage, but the age group of the people who are getting the infection, what's the word I'm looking for? The transmitter, the quick transmitter, are young people. So don't you think it's better to vaccinate teenagers, younger people who are fast carriers? I don't know the word isn't it, Rachel, but I'm sure you'll tell me what the word is. So once they get vaccinated, then by default they won't pass the virus on to the vulnerable and the elderly. So I don't know. Have you got any answers to that? And I understand it's national policies, but
well, I'll have a go, and Jane will have some comments as well. I think it's always important to say that we are constantly learning about this virus. There is still so much we don't know. So the concept of super spreaders, which I think is the word you meant, there's been claims that certain people, certain age groups are super spreaders, and I don't think that's necessarily been verified in terms of the genuine impact that that's had. I think that when you think about something like colds and flu, and for people who've got young children or young grandchildren, you'll know that, you get a group of kids together, they pass colds around like like it's Smarties. It's always how that works. COVID seems to be different in terms of how it's spread amongst particularly children. It doesn't have the same pattern of spread. So the super spreader argument hasn't really come to fruition. What the lateral flow does do, though, is it does identify people who are potentially shedding that virus more because they've got a lot of it, and that could be transmitting to more vulnerable people. I think the other thing is they tend to look at vaccinations in how do we protect the people that are most likely to die and most likely to be severely injured, severely ill, and those that are likely to put an impact on our hospital system. So it is much safer to vaccinate those people that are in that category, so the older age group, because to be honest, it just takes one person to pass it on to a vulnerable person in a care home, and they could die very easily. So the benefit and the speed, if you were to vaccinate a younger age group, would never protect those people in the way that we would need them protecting. So there is a scientific rationale for picking this. And I think that, in 10, 15 years' time, when we look back and we know everything there is to know about COVID-19, there might be things that we said, well, if we'd have done that. But at the moment, there's no evidence to suggest that super spreader is a real thing. I think there's just people who are symptomatic, people who are not symptomatic, and we don't even know why yet. So the best strategy for this is to protect the people who are going to be the most severely affected, and that's why they're doing it by age.
Yeah, I've got two questions. The first one I'll ask, and you may or may not know this, but the question is: recently there was a video that went viral on WhatsApp outside one of outside the testing the vaccination centre in Batley, where a member of the public was saying that this vaccine is fake and all the rest of it. One of the things he was saying that it's not permissible within Islam, and he's asked me, do you know? Can you comment on that? Well, my view is very clear. I'm Muslim myself, and the vaccine has actually gone through a number of processes within the Islamic jurisprudence system, and a number of priests, we call them ulamas and muftis, who are like people who can actually issue rulings on what's permissible and what isn't, and every single organization that issues these rulings have actually given the green light that they are permissible, and you should take them. And so the Islamic ruling is very clear that you should take them, and in some cases they've actually gone a lot further than that. So from that, I can only say that we have to respect our ulama, we have to respect our Islamic scholars who have actually spent a lot of time, and this is up and down the country and indeed internationally. They spent a lot of time looking at the detail, looking at the ingredients, looking at the processes, looking at the derivatives, and their judgment is the rule of law. So on that basis, yeah, it is permissible, and you should be taking them. It's very easy that there's a lot of fake news around that sometimes is the best one in the world, and it is very sophisticated that you can't even tell if it's true or not. But I've just been sent a WhatsApp image of Sadiq Khan taking the vaccine with the needle covered, and I've just sent my friend a message back saying he shouldn't be taking the vaccine anyway because he don't qualify. So he just sent me back something saying that yeah, he just qualified it and he's actually fake. So fake news is so powerful that it can make reality look like it's fake, and it can make fake look like reality. And unfortunately, there are people in our community who, good people, but they get taken in. So on the subject of is it permissible, from all the paperwork and documentation I have seen, it is halal. That is the, and I that's my view as well, and that's a fact. The other question, Rachel, was around. Let me just check this all in 1 minute. Let me just if people know of any shops or any outlets that aren't following public health guidelines, and we've all had complaints about, oh, this is happening and that's happening, and oh, it should be Tesco's, right? They're going around without face mask. Can you get the police on? What is it can we do? And I think there are some enforcement powers that we have had issued recently, isn't there, as well? So you want to just
yeah, absolutely. Thank you for that. And I think for a vast number of people, they have reported this into the local authority, either via your local councillors or direct. We're really keen that people do that as much as they can, using directed to the sort of council website if needs be. But we want to be able to get an understanding of where those shops aren't following the rules, so that we can send our environmental health teams out to assess. And what our environmental health teams do is they go out and have a look at the shops. They'll do it at different times in terms of when we've got people, if it's a rush after a school pickup, etc. And they will look at what rules are being followed. And we've done a huge amount of work with a lot of supermarket shops in terms of picking them up on when those rules are not followed, because if we are all doing our bit as members of the community, it's important that shops and supermarkets are also doing that to make that whole shopping experience safer. And as the leader said, the local authorities have been given more powers to be able to close businesses if they are persistently not following the rules. But often that we found it's just that they just needed some support. So we always take the stance of being supportive first, and then we can move on to where we need to take more punitive measures, which obviously would be a last resort, but we wouldn't hesitate if it risks public health. And if people are just breaching the rules, then we need to know about it. So we would just encourage everybody to report in about the venues, because that would really, really help. So yeah, thank you for that. I think that's a helpful point in terms of the powers that we've now got.
Yeah, thank you very much. Another question just come in. Once somebody gets tested, how quickly do they find out the result, if they've been positive or negative or inconclusive?
So I think if somebody has symptoms and they book in through the normal website and go get a test, now that's the one that gets sent off to the lab, and ideally we'd want that result back between 24 and 48 hours. Depending on how the lab capacity is, it might be a little bit slower, but that's what you'd get if you have symptoms. With these new lateral flow tests, you will get a text with your result within 20 to 30 minutes. So that's much quicker in terms of getting an instant answer in terms of whether you at that time have the infection, and that's just an additional layer of reassurance on top of those other public health behaviours.
Okay.
Should we also say, Rachel, sorry, that if they do have a positive lateral flow test, we do then obviously want people to go and get the PCR test to confirm that test.
And that's just about belt and braces, so that we can get that test done, get that confirmed, and then that'll give you the ability to access the self-isolation payments, which I know is something that is obviously available for people who need support with the 10 days self-isolation, which is obviously, it's now changed to. It's probably just worth, if that's okay, Leader, just reinforcing that the guidance has changed now in terms of self-isolation. So it was previously 14 days if you were a contact, but actually it's now 10 days, and that is because they've looked at how the virus is shed from an individual that has it, and after 10 days the risk of shedding that and passing that to someone else, even if you've had it as a contact, is very, very low, and so that is why that's been reduced to 10 days. So that's obviously something that the schools have had to change their procedures about, because they were obviously sending contacts home for 14 days. But if you're a contact, the chances of you having it after 10 days is very, very small. That isn't the case for health and social care staff. That's still 14 days, but that's just to add an even bigger bit of protection in for those that are working with our most vulnerable.
Yeah, questions are coming thick and fast. I've got another question here, and we've got no time left. Well, we have got time, but we've got 10 minutes. But I'm really appreciating that the questions that are coming in. One question that's coming in is, what about getting the messages across to the older generation in our communities, whose first language is English?
I think there's multiple ways that we've found, certainly with getting the messages about the virus, and I think there's probably the message in terms of the virus and testing, and the message about the vaccination. So we'll be using it for both streams of work. What we found is getting members of the community to film themselves giving the messages out in relevant languages has been really successful. So any volunteers for people who would be prepared to do that would be fantastic. So I'd be keen to hear from you if you want to do that. We've also got published material in different languages that we're able to send out as well, and we keep updating that as the information comes through. But actually we have found that the kind of talking heads approach seems to be much better, and especially if they're obviously connected digitally, and then obviously for those that aren't necessarily connected digitally, it's those messages being reinforced in the places that those people go. So whether that be a faith setting or a community group, or indeed in any other setting, then we'd use all of that opportunity to get those messages out.
Thank you. Jane, do you want to add anything?
No, I think that covers it. Thank you, Councillor.
Okay, and another question coming in terms of the reliability of tests, both the lateral flow test and the PCR test. First, it's quite a long question. I'm trying to paraphrase it. The first is, are they both as reliable as each other? And the second part is the LFT more, or is the lateral flow test less reliable?
It's a very good question, and it's an interesting one, and it creates a lot of academic arguments, I think it's probably safe to say. The most reliable test you can have is the PCR test, the one that goes away to the lab and gives you the result. That's over 90% accurate. That is the test that will give you the answers. The lateral flow device, that because we're still piloting in a lot of places, that there's no definitive answer to how accurate it is or it isn't. There's different figures that are being quoted. From my perspective, I think that's why, as Jane said, we're keen for people who get a result to then get it confirmed with a PCR. But if you think about it, what that does is it gives you 48 hours of time that you wouldn't necessarily know that you had it, where you can self-isolate. So it's like an additional measure on top of PPE, on top of social distancing, and it will help you to feel reassured and to be given to others some reassurance. Any test, though, especially if you've not got symptoms, is only as good as the day that you take it, which is why getting tested regularly is so important, because that helps you to feel confident that each time you are not passing it on. And that's why we'd be looking at how we look at frequent testing in those settings where we've got people who are potentially more vulnerable. So again, we're still learning, and hopefully by us implementing lateral flow testing, we'll get an idea. And I think the important thing, which I know the leader and his cabinet have pushed for, is the test is only one part of it. It's about the support that we're providing around it. So all the community staff and the other staff who will be working alongside the testers in those sites will be able to really help people in terms of what the test means, what they need to do on the back of it, and why it's so important to still keep with those public health messages.
Right, thanks, Rachel. Another question that's come in is, in terms of the vaccination, how many people, or what percentage of Kirklees population would need to be vaccinated before we were classed as having herd immunity? That's a really good question, because I think if we can get everybody vaccinated before Christmas, we'll be okay. What happened there? But anyway.
Jane, do you want to?
I think they're looking to get about 70% protection to hopefully get herd immunity. That's the figure that I've seen in reports, to be honest, leader.
Yeah.
Right. Okay. Right. Okay. We're just coming to the 5 to 1. I think we've covered the questions, right? Yeah, that have come in. There were some questions that were repeated, right? Yes, I didn't want to repeat the same question. I tried to bunch them all together. But once again, I really appreciate the time people have taken out to join today's webinar, and thank you once again for the support that you've shown, not just in the chat that you've been putting on, but the support that you've been providing us throughout the pandemic since March. And like I said, you know, it just amazes me the amount of energy and the passion that the community show, and every time there's a challenge, you know, we just rise to it. And I believe Kirklees is probably the best one suited to do that. I'm sure the other authorities actually have the same to say, but I really believe that we are probably one of the exemplars. And that's why what I've done is I've actually put forward through the LGA the achievements that we've had in terms of how well we've actually coped as a community. So hopefully we might get a national award, and something might be picked out. But once again, thank you very much for all the hard work, all the commitment and the support you've given us. And we will hopefully have more of these, Rachel. Yes?
Definitely, absolutely. And I'm really keen for people to come forward and help us out with the comms and the engagement, because I think that's going to be where we succeed if we get that.
Yeah, I think we need to take that away and just think about how we can do that, because there were some really positive messages that are coming out. You know, if we can get use the churches, the mosques, the temples, the synagogues, the community centres, and if we can actually get a cross the interfaith sector, the faith leaders and the community leaders coming together, social distance, and doing some kind of a photo shoot, and then get them out in the community organisations. That will be so powerful. It will make our job a lot easier.
Yeah.
So thank you very much for all your time, and hopefully wish you all a very Merry Christmas and a Happy New Year. Let's hope next year. Well, I know it will be a lot better, because we can't go backwards. In the meantime, wash your hands, keep wearing masks, and please keep social distance. And hopefully we'll control the virus over Christmas. Once again, have a nice time, whatever you're doing. Good night and God bless.